Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Hello, everyone. Welcome to Breakfast with Spaniels, Lunch with Spaniels, depending on where you are. I guess for some of you it might even be dinner with Spaniels, who knows. And the Spaniels are outside the room. They're not very happy that I didn't let them in. So we posted a blog today that I wrote recently on Lyme disease. And one of the big problems that we see with particularly dog owners, but cat owners too, is people get really freaked out about the possibility of fleas and ticks attaching to their pets and transmitting disease. I get it. I understand that there's a huge concern. And what I hear all the time is people saying, oh, I don't want my dog to get Lyme disease. I'm so afraid of Lyme disease. Lyme disease kills animals, blah, 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 and people. And the problem is Lyme disease is only one of many tick-borne diseases that our pets can be afflicted with. So it really is not all about Lyme disease. It's really all about tick prevention. And this is the time of year. It's already starting to warm up down here in North Carolina. It was in the upper 70s, lower 80s the past few days. It's going to cool off a little, but we're in that season where things are starting to warm up. And as the weather starts to warm, the tick activity will increase tremendously. Ticks are in our environment 12 months out of the year, but they definitely have seasonality as far as when they're at their most active. So up in New Jersey, it was sort of the end of March going into April. Down here, I think it's a little bit earlier, kind of early to mid-March. We start seeing more activity with the ticks. And so this is the time of year when there's a lot of tick breeding going on. So if you're walking through the woods, you might get into a tick nest and you get all those little nymphs. When I was in 5th grade, I got into a nest of, we called them seed ticks, but they're basically the immature stages of the tick. And I literally was covered. And I mean, it's so hard. And I've had pets come in that have gotten into nests, and they come in with hundreds of these attached to their body. And that's problematic and concerning. I know for me, my mother threw me into an extremely hot bath, as hot as I could stand it, and that was how we managed to get these things to back out and fall off and go away. This is a time of year when we are going to see more activity, and it's actually only a small percentage of ticks that carry Lyme disease, but they can carry Rocky Mountain spotted fever, babesiosis, ehrlichiosis, anaplasmosis. There's so many things that we need to be concerned about. The Lyme vaccine, I talked about it in the blog, but the Lyme vaccine is really not very effective. And there is some thought that the vaccine can actually make the disease worse if your dog is vaccinated and then they have a tick transmit Lyme disease organisms, the Borrelia, to them. What happens is the body makes these immune complexes, which is basically the antigen. So that's it's like the puzzle piece that comes from the Borrelia organism, and then the body makes an antibody to it, and the two of them stick together, and they make a fairly big molecule. And so what happens is those antigen antibody complexes are deposited in certain areas in the body, particularly in the kidneys, which is why we can see kidney disease and kidney failure. This is kind of apropos since we're having kidney disease next week. Those complexes can deposit and stay in the kidneys. And so part of Lyme disease nephritis, or Lyme disease kidney inflammation disease, is these antigen antibody complexes causing basically an autoimmune type reaction. And so the body is actually reacting against the kidneys and against the joints where these antigen antibody complexes are formed and deposited. So there's one school of thought that says, and we have some good studies on this, that says that when we have vaccine antibodies running around in the system already, and then the animal is infected with the organism, we actually have more of those immune complexes, and more damage is done to the joints and the kidneys. And I will say, before we really knew much about Lyme disease, oh Lord, I'm trying to think, it was in the late 90s that we really became aware. I think that's about the time frame. I remember we were in our Clayton office, kind of new, and we moved in there like 95. So I would have these, a lot of dogs coming in with kidney disease, kidney failure. And we didn't have a lot of information as to why we were having so many dogs in kidney failure. And then I remember the veterinarian from Lyme, Connecticut, where Lyme disease kind of was originally seen so much and researched, and that's why it's named after that. He came down and did a lecture for all the local veterinarians and talked about what Lyme disease was and how it affects the body. And suddenly we had an answer. So when you have an animal with symptoms of something, and we haven't discovered that disease yet, so before Lyme disease was discovered and given a name, we had these animals who would come in limping, low-grade fevers, swollen joints. We would have animals coming in with really bad kidney values, and we had no idea what was behind all of that. So that was about the same time that all the veterinary labs started coming out with testing for Lyme disease, and they came out with the little snap tests that you could do in the office, and in 10 minutes you'd have an answer of whether this animal was Lyme positive. Now, like a lot of testing, it's fraught with false positives, false negatives. If the animal hasn't built up enough of an immune response yet to have the antibodies showing up, or there's not a high enough number of infective organisms there, then you could get a false negative. So we started doing test and treat, and we didn't know a whole lot about the disease. We had some information, but not a ton. But we instituted a test and treat. So every dog that came in the office, along with their heartworm test, started getting tested for Lyme disease. Any animal, and because we didn't know as much about it at the time, any animal that came up with a positive test, whether they had symptoms or not, automatically got 1 month of doxycycline, which is the antibiotic of choice. And the problem with doxycycline is a lot of animals vomit with it. It's pretty hard on the stomach. So we had to deal with that as well. But what was very interesting, and then we didn't know what to do if we came back and retested them at the end of their antibiotics and they were still testing positive. Did we have to go through another month of antibiotics? Which frankly, for a while, that's what we were doing. And unfortunately, some of these animals spent 6 months on antibiotics, which is not cool at all. But we didn't know enough to know what we were seeing. So we've discovered with time that those tests can remain positive for many months after they once show up positive, even with treatment. And we now have better tests that can tell us whether we still have active disease ongoing in the body versus, it was a past exposure, but there's no problem with it. And we started doing further testing, like looking at, are they losing protein in their urine? Do they have active infection? Should we treat them? Or did he just have an exposure, manage to deal with it? The immune system actually did its job and we don't need antibiotics. So we're using a lot less antibiotics now because we have better testing for it. So what we did see once we started that test and treat program is that suddenly our number of dogs with kidney disease and kidney failure went way down. Because these were dogs who were younger dogs who were very active. We lived in a very high-tech area in New Jersey, and a lot of these were outside dogs that were running through the woods and the fields and the high grasses and, places where ticks live. And they weren't having any kind of preventive care. So very commonly their immune systems didn't work very well. So these would be dogs that came in positive for Lyme disease, heartworm disease, and usually whipworms. Whipworm is the interesting worm, intestinal parasite that usually shows up when the immune system is suppressed. And so almost every dog that we ever diagnosed with heartworm disease also had whipworms. It's kind of an interesting correlation. So these are animals whose immune system wasn't being stoked by anything good. They were eating, poor quality dry kibble poured in a bowl outside. A lot of these dogs lived outside. But we did see less dogs dying and less dogs being diagnosed with kidney failure. So the test and treat program actually worked very well. And we stuck with that for probably 3 years, again, because we didn't have any better testing and we didn't know anymore. We also didn't have or weren't aware of as many good natural products for tick prevention. And I think at that time, the only thing we really had available that worked well for ticks, we had organophosphate chemicals, which are definitely not good. And then I think Frontline came out sometime in that general time frame. And so we were basically selling a ton of Frontline to try to keep ticks from spreading Lyme disease to our dogs. But again, we have to remember that it's not just Lyme disease, it's any tick-borne disease. So it really is not about giving a vaccine that may cause more harm than good. It's not a very effective vaccine. It's only anywhere from 40 to 80% effective, depending on when it's given, if the dog has already been exposed to or had Lyme in the past. What their immune status is, how they're able to convert the vaccine. So it's not a great vaccine. We don't know how long it lasts. We don't really have a titer for it, although the Acuplex test by Antec Lab, that one, it will tell you that it's detecting antibodies from the organism, whether it's acute or chronic, or whether it's detecting antibodies from vaccine. And we had dogs who had had a vaccine in the past, but had not had a booster vaccine in 7 or 8 years, and we were still detecting vaccine antibody. So we know that the antibodies stick around for a long time. We don't know at what level, and then there's still all this discussion about do we really need a titer at a certain level, or because we can't measure the memory cell response, would that kick in and take care of things anyway? So we don't have answers on that, unfortunately. But so this is the time of year, like, we should always be vigilant for ticks, but right now, over the next few weeks, is when we need to be even more vigilant. So if you are going out in the high grasses or going out in wooded areas with a lot of underbrush, that's where ticks live. They like to live in shaded areas. They like to live in the taller grasses, the undergrowth. They don't like to live in your grass that is mown short in your backyard in direct sunlight. So I talked about things in the blog that you can do as far as how your yard is laid out, having deer-resistant plants so that you don't have as many deer. That brings less ticks. I saw some great pictures when I was looking for a picture to go with the blog of deer with literally thousands of ticks sucking blood on their ears. I decided it was a little too graphic and might upset people. But they do carry a high tick burden, and if they're coming in your yard, that's how you're getting those Lyme disease ticks in your yard. So deer-resistant plants, keep your yard mown short, try to keep your dogs, particularly this time of year when the ticks are more active, out of areas where the ticks are going to be found. I never find ticks on our dogs. They don't go in the woods. They don't go in high grass. They are out in a mown yard in the sun. So we definitely need to be using things like the essential oil sprays and powders, the Buck Mountain parasite dust. All of those things are really good repellents. You have to be more vigilant and more on top of things when you're using the natural products. It's not a pill that you're going to give once and it's going to last for 3 months. It's not a topical that you're going to put on once a month and say, oh good, I'm done with that. It is something that you have to stay up with every single day if your dog or cat are going to be in high tick areas. So it really is about lifestyle choices, and I get it if you're someone who likes to do a lot of hiking, likes to, you have hunting dogs, you're hanging out in areas where it's a high tick population, then you are going to have to be more vigilant. So, okay, that's kind of my update. And for more information, the blog has tons of information. It was posted on Facebook and Instagram, but it's also on the website, drjudymorgan.com, if you want more information on that. Okay, I got a ton of work to do. Shocking, normal, is what it is. Everybody have a wonderful morning, afternoon, evening, wherever you are.